Hello, I am Elizabeth Pavia, and this is the case study presentation for obesity management for the clinical practitioner. So, this case is on Kelly D, who is a 19-year-old female that is 5'4", weighs 195 pounds, and came in for a weight loss consult. And these are some of the complaints that she has also shared that we must take into consideration. So based on the information that we were previously given, we can determine that her BMI falls under the class 1 obesity category, and other anthropometrics that we can obtain include the waist to hip ratio, the skin impedance, and waist circumference. As for body composition, it is also important to obtain, and we can do that through the bioelectrical impedance analysis, which is a quick and safe method that provides estimates of fat mass, fat-free mass, and visceral fat. That does not include physical strain, which is important since she has reported complaints of back and knee pain. Typical obesity treatments at class 1 with comorbidities usually include a weight loss plan and weight loss medication prescription, but we must know more before we prescribe those weight loss medications for a 19-year-old. In order to appropriately make a weight loss plan for Kelly, we must know some more information that work with her preferences and her lifestyle and her state of readiness for change. Based on her complaints, it is important that we test for sleep apnea if not already done so, and determine where her back and knee pain are originating from. It is also important to know if she is currently taking any medication for depression and anxiety that could be contributing to her weight. These labs are typically conducted and are relevant in people with obesity due to comorbidities like hypertension, diabetes, increased risk of certain cancers, impaired renal function, and anemia, among many more, which should be addressed and treated within the weight loss plan. So some comorbidities that Kelly may have with the information we also have without the labs are sleep apnea, which can contribute to insulin resistance, dyslipidemia, hypertension, and a sleep study is needed to diagnose obstructive sleep apnea. Incidence of depression is higher in patients with obesity, and some antidepressant medications have been found to contribute to weight gain. The knee is also the most commonly affected joint that suggests systemic inflammation like sleep apnea does. So Kelly's family dynamic. Kelly's mother shames her on her weight, calling her names and stating things that are not true about her or any individual with obesity, saying that they are lazy, greedy, and has no willpower, blaming and leading to her weight. It is important to educate her on why saying those things can cause more harm to Kelly and could potentially discourage her from keep getting the proper help for her weight loss journey. As for her father, explanations to him can go along the lines of, my focus is not to put Kelly on a strict diet, but to help her develop healthy lifestyle habits that support her physical and emotional well-being. So the following recommendations of 150 minutes of exercise per week, estimated needs, and protein and fiber are recommendations typically given for weight loss treatments or guidelines to improve lifestyle habits. Since Kelly has complained about back and knee pain, it is important to recommend low-impact exercises such as walking, swimming, yoga, and stretching that will allow her to have some physical activity. I used the Mifflin-St. Jean equation to calculate caloric needs, and I also showed a 500 calorie deficit, which is also commonly recommended for weight loss, and it can be adjusted based on her tolerance and depending on the follow-up appointment. These are just guidelines again, and they can be adjusted based on Kelly's needs and what she believes will be possible to accomplish in goals that we will show later on. As dietitians, it is important for us to set up our clients for success by setting realistic goals that will eventually reach that bigger goal. This can help Kelly reach her weight loss goals compared to previous attempts, and hopefully make it easier for her, as she stated that she's had a hard time losing weight. So the smart goal above: walk for 25 minutes 5 days a week for the next 3 months to increase physical activity levels and support weight loss goals, should be attainable even with her knee and back pain complaints, since walking is a low impact exercise but can always be adjusted. It is also important to use motivational interviewing to increase confidence and autonomy, and encourage to keep seeing therapists for anxiety and depression. Not focusing on numbers will help improve lifestyle changes without contributing to detriments and pressure of numbers, like seeing her weight change so much or not change as fast as she wants it to. But continuing bioelectrical impedance analysis every 4 to 6 weeks would be appropriate to determine any changes. It is also important to inform her of the importance of setting small and flexible goals and normalizing setbacks, and the importance of educating Kelly on those possible setbacks that she may encounter and how to work past them will help problem solving and self-confidence towards weight loss goals. So within motivation, when it can be low, it is important to educate her on why it is important to set those SMART goals, since they are smaller and flexible. And eating patterns and behaviors, it's important to keep seeing the therapist for depression and anxiety, just to ensure she's not emotionally eating due to stress or anxiety. As for her back and knee pain, she might end up skipping exercise sessions, so it is important to determine if we might need to prescribe some pain medication or change that SMART goal or the physical activity to something else. As for the family support, we've already discussed the stigma and the myths on obesity, so hopefully they understand a little bit more and are able to provide some non-judgmental support. In the first consult with Kelly and her parents, we spoke about setting small and flexible goals for weight loss that take some difficulties into consideration, such as her pain and breathing difficulties, as well as her family dynamic. We also educated them on obesity bias and myths that are not helpful to Kelly, and we set realistic expectations and some healthy support for her. In the follow-up, we will use the BIA to compare changes in fat mass, lean mass, and hydration status. We will also determine if the SMART goal we set was successful and her confidence level in accomplishing it, then work on setting a new SMART goal. And in order to incorporate more nutritional guidelines that align with Kelly's lifestyle, I previously asked her to complete a food log and if there's any changes in her satiety following prior adjustments, and once again review levels of pain.